Hi everybody, and today is the first video of a series all related to endometriosis. I am Dr. Tan Yiping, consultant obstetrician and gynecologist. Previously, I had a few videos on endometriosis, so it's all going to be on endometriosis and will go on every week until I finish all the questions. Endometriosis is a disease whereby the endometrial lining of the uterus has already gone to a different place, because we call it as ectopic growth of endometrial lining. That means the endometrial lining, which is supposed to be in the center of the uterus, has now gone to another place that is no longer in the center of the uterus. It can go to any other parts of the uterus: ovary, fallopian tube, cervix, vagina, bowel, ureter, bladder, anywhere. I've seen it on the liver, in the lungs, in the heart. So basically, endometriosis can go anywhere. And because endometrial lining is something that grows every month and passes out during our menses, but endometrial lining that is growing anywhere else, it will still grow every month together with your menstrual cycle, but it is unable to pass out. And because it cannot pass out, it becomes something that is abnormal and continue to grow and grow and grow over time. Number one is, of course, we all worry about cancer change. But cancer change, although it is a very big thing, but it is not so common. Endometriosis is quite common. It's about 20 to 30% of women, but very rarely does it turn into cancer. So most of the time it doesn't become cancer, although it can, but it's very rare. So even though it's a problem, but it's not really a problem that affects a lot of women. Women suffer more from endometriosis mainly because of two things. The two common problems. Number one is the pain. Some women have horrible pain with endometriosis. Pain that nothing else can help them. Painkiller doesn't help, they cannot go to work, they have to take MC. And the other situation is when they cannot get pregnant. When they cannot get pregnant because of endometriosis, a lot of women actually reach a dead-end road. They are very devastated. They do not know what else they can do because they can't get pregnant and they want to get pregnant and they don't get pregnant. You know, there are a lot of implications for not getting pregnant. So these are the two main big problems with women with endometriosis mainly. Of course, other than that, because of the spread of endometriosis to other parts of the body, it does give itself some problem, like kidney may die off because of endometriosis. You may not be able to breathe every month you have your period because it has gone to the lungs. But having said that, these people with such extraordinary type of endometriosis are actually very, very rare. So mostly people are still suffering because of the pain and also because of unable to get pregnant. To describe endometriosis as an invisible disease. Why I say invisible? Because I can't see it. Very often we can't see it. Endometriosis, we know, is due to the lining of the uterus in a different place. And this lining of the uterus, when it grows in somewhere else, sometimes it's just little spots, you know, that could be just like 2 mm, 3 mm. It's just 2 to 3 millimeter. It's so tiny. It's so tiny. Even if it's 5 mm, 4 mm, it's still very tiny. And because it's so tiny, it's really very difficult to see it on ultrasound scans. You need time, many years before this little tiny spot grow into something big. Maybe it grow as a cyst, or maybe it grow into a growth like a fibroid. Because endometriosis in the ovary, it can form a cyst if you keep long enough. So then you will see the cyst. But in the uterus, it will form something like adenomyosis or adenomyoma. These are the things you can see on ultrasound. And that is why most women at the very early stage of endometriosis, they don't know what is the diagnostic test for endometriosis. Diagnostic test for endometriosis is laparoscopy. You need a laparoscopy. You can't see it on ultrasound still. You can't see it on MRI still. Basically, you need a surgery to know whether you have endometriosis or not. So that is why I say that endometriosis is an invisible disease. Depending on where your endometriosis goes. Endometriosis in your uterus cause you period pain in the center. Endometriosis of somewhere on the right side, your pain is on the right. Endometriosis somewhere on the left, pain is on the left. I always tell people, if your period pain is on the right or the left, you are endometriosis. That is not period pain. Because period pain is from the uterus, so it should be more center. But having said that, even adenomyosis, that means endometriosis in the uterus, can also cause pain in the center. But once your pain is on the right, on the left, that is endometriosis. Once your pain goes down into your leg, that is endometriosis. You have thigh pain, knee pain during period. You have backache during period. That is endometriosis. You have pain when passing urine during period. You have diarrhea during period. That is endometriosis. You need to think of endometriosis whenever you have any form of pain. Tummy very bloated during menses. Gastric pain only during menses. That is endometriosis. Why gastric pain only during menses? Gastric nothing to do with menses. You have pain when you breathe during menses. Any pain you have during menses, anywhere uncomfortable during menses, that is endometriosis. There are many more symptoms of endometriosis, honestly, like pain during sex, same period pain that happens again but it's not period, maybe during ovulation. And how to confirm whether you have endometriosis? The one way that's 100% to confirm is laparoscopy. But, I want to say but, because that is conventionally and that is what we always think. But there is something that came up the last 5 years. We call the IDEA scan. This IDEA trial came up because a lot of people are very desperate. How to find endometriosis? Do we really have to do surgery to go and find it? Because we know now, endometriosis, we can give you treatment by tablet. I got medicine for endometriosis. But then I want to diagnose you first before I can give you medicine, right? And then to diagnose, I have to do a surgery, I have to do a laparoscopy. Is there a way? I don't want to do a laparoscopy, but I want to see, to confirm your endometriosis. Is there a way? So when this thing came up, it was only the last few years. So since the middle of last year, we have started implementing this deep endo scan. Okay, so see you again. Please subscribe to my YouTube channel, yeah? And also switch on the notification button. Okay, bye!